Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa sallam. Dear viewers of social media, Assalamu alaikum wa rahmatullahi wa barakatuhu. I hope you are well, and it is the blessed day of Friday. And Alhamdulillah Azza wa Jal, although we should be reciting the Rood Sharif upon the Prophet sallallahu ta'ala wasallam abundantly, but especially on the day of Friday, there are countless blessings and barakas. And it is narrated that whoever recites Durood Sharif upon the Prophet sallallahu ta'ala alayhi wa sallam 200 times on a Friday, inshallah, 200 years of his sins will be forgiven. Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa sallam. Once again, we are live with Dr. Rizwan in our silsila, in our program, Health is Wealth. And in this episode, inshallah, we will try to focus on knee problems. It's another very important joint in our body. And as you know, Dr. Rizwan is an orthopedic consultant. He, mashallah, works in Lincoln Hospitals. So, Dr. Rizwan, first of all, Juma Mubarak, and secondly, welcome to you to our silsila. And we are very grateful for your time.
Thank you very much. Juma Mubarak to you as well.
Chala, inshallah, today we are going to talk about knee problems. And again, we have some slides as well, some pictures, some images, so that you can understand the issues and the problems. Although this slide will come later on, but this just used as a title. So Dr. Rizwan, first of all, I would like you to tell us a little bit about the knee joint, and also English and Urdu. I have had some viewers requesting me that we shouldn't ignore the Urdu viewers as well.
Okay. So first of all, brief introduction about the knee joint. The reason, one of the reason myself and yourself agreed to discuss about this joint is the knee joint is the biggest joint in the body. Biggest of all the 326 joint, how many we have got in the body. This is the biggest joint. The knee joint is supported by about 14 ligaments, which includes the articular, which includes the meniscus as well, which is a type of cartilage. Since we are discussing this joint, just one of the important thing which will actually realize you that how important is this joint is that in the NHS, the National Health System, out of the 3 top procedures or operations performed, out of the 3, 2 of them are performed on the knee. One is a total knee replacement, and the other one is the knee arthroscopy. So you can imagine the importance of this joint and the problems we have got in the community as well. उर्दू में ब्रीफली घुटने जिस्म में जितने भी जोड़ हैं, सबसे बड़ा जोड़ घुटने का जोड़ है। इसमें 14 लिगामेंट्स होते हैं जो उसको स्टेबिलिटी प्रोवाइड करते हैं। उन 14 में से ये जो 6 हैं ये बहुत ज्यादा इंपॉर्टेंट है। इसके अलावा बाकी भी इंपॉर्टेंट है, but these 6 are really important and they are commonly these are the one which get commonly injured.
अच्छा, अब देख ले, अगर मैं इस थोड़ा सा मरीजों की नुमाइंदगी करूं, और ये जो इमेज हम देख रहे थे इंशाल्लाह दोबारा स्क्रीन पर आएगा, तो इसमें 2 बड़ी बोन्स हैं, एक ऊपर एक नीचे, और 2 बोन्स आपस में मिल रही हैं, और बोन्स के बीच में भी जो है वो सॉफ्ट टिश्यू है, और इसके इर्द गिर्द भी जो है वो बड़ी मजबूती के साथ जो है वो लिगामेंट्स हैं। तो इस हवाले से थोड़ा सा अगर आप मजीद हमें कोई नाम वगैरह और ये लिगामेंट्स कैसे जो है इस मसल जॉइंट को स्टेबल रखते हैं, अगर इस पर थोड़ी सी आपकी तरफ से रहनुमाई हो जाए।
जी, नी जॉइंट जो है इसमें अब ऊपर आप देखेंगे कि आपकी थाई बोन फीमर है, वो आर्टिकुलेट करती है टिबिया के साथ। टिबिया और एक छोटी सी बोन साथ नजर आ रही है, वो फिबुला। तो ये आपका मेन नी जॉइंट्स है। इस पिक्चर में जो चीज हमें बड़ी वेगली नजर आ रही है वो है नी कैप, जिसको हम पटेला कहते हैं, जिसको चपनी की हड्डी भी कहते हैं, ऊपर नजर आ रही होगी। अब इफ यू सी देयर आर वेरियस लिगामेंट्स, मीडियल कोलैटरल, मेनिस्कस जो बीच में नजर आ रहे हैं, जो डिस्क के जोड़ के बिल्कुल बीच में, वो आपके शॉक एब्जॉर्बर हैं घुटने के, जैसे गाड़ी के शॉक एब्जॉर्बर होते हैं, और लोड डिस्ट्रीब्यूटर हैं। दे आर वेरी वेरी इंपॉर्टेंट एंड दीज आर द वन व्हिच गेट commonly injured in the younger people or the middle-aged people, I would say. उसके अलावा जो right in the middle of the knee joint, you can see two ligaments. They are like cross shape. One is called an
एरो भी
ACL.
मैं जो है वो वहां पर कर रहा हूँ
जी, ये जो आप जहां पे आपका एरो है, ये है ACL, cruciate ligament. This is the commonest injured ligament, one of the commonest injured ligament in footballers and rugby players. Very important for the stability.
This is inside the joint, not outside, because we got people may be thinking that this is external, but this is all inside the knee joint, well protected, cannot be seen unless you open the knee joint.
That's correct. These are inside the knee joint, and there is another one which is even bigger than this one, which is right at the back of this ACL. अगर आप गौर से देखें तो नॉच में आपको थोड़ा सा एक और लिगामेंट नजर आ रहा होगा. I think it will be probably difficult to see, but the one on the front
we can see the one here.
Right. So yeah, I'm sure you can see it's right at the back. You can barely see it. Yes, that's the one. नॉच के अंदर जो दो लिगामेंट्स हैं, एक ACL है और एक PCL है. They are very important to provide the anterior posterior front to back stability of the knee. और साइड के ये जो दो लिगामेंट्स हैं, medial collateral, lateral collateral, अगर आप इन पे एरो लेके जाएं तो ये नी जॉइंट के आउटसाइड होते हैं, but they are very important for the stability of the knee. ये lateral collateral है जहां आपके एरो है, और दूसरी साइड के उसके बिल्कुल ऑपोजिट medial collateral है, which is probably the biggest ligament of the knee. Medial collateral ligament. अगर ये ligament rupture हो जाए तो आपकी नी बहुत ही unstable हो जाती है. इसके अलावा मेनिस्काई हैं, जो कि आप अगर एरो लेके जाएं डॉक्टर जीरक, मेनिस्कस पे medial meniscus, जी ये जो है, these are the shock absorber of your knee and they are the load distributor as well. They are very important. These are the ones which get commonly injured in middle-aged people, even young people as well. And the problem with them is it depends on the type of the tear, whether it's repairable or whether you have to resect it. If the patient is younger, you have to repair it, ideally. If the patient is middle-aged person, or the ligament is not repairable, or then you may have to resect it and take the torn part off.
So inshallah we will come later on to obviously protections or preventions, precautions that we can take to make sure that this joint of ours is well looked after, and what factors also are important in terms of looking after our knee joint for a long term. Now clearly the age in the westernized countries is increasing, getting longer and longer, so people are relying on knee joints, and clearly knee joints are very important in terms of standing, in terms of walking, in terms of sitting, and most important